It's time to address racial inequity in population health. Conversations we have now, actions that we take will shape our path forward.
We can't be afraid to talk about race. We have to open our eyes. We have to talk to each other. We have to listen to each other.
It is absolutely time that we are having these discussions. We have been talking a lot about the social determinants of health, access to housing, equitable educational opportunities, transportation, food security. But we also need to even look further upstream at those structural determinants of health, structural racism and interpersonal racism and those unconscious biases.
At Humana, we've had a long-standing commitment to trying to address some of those key drivers of disparities. And the bold goal, which was announced only 5 years ago, with the goal of getting really deep into communities, understanding the fabric of communities, partnering with community-based organizations, with local governments, with providers, with key partners in communities to understand how to address a whole array of challenges, very personal challenges that our members experience in achieving their best health, that many of which are driven by their social context.
There's demonstrated data to show ethnic minorities, particularly African Americans and Latinos, are lagging behind that overall general improvement in quality and quality outcomes. I do wonder if we spend enough time talking about care delivery itself and how that contributes to these disparities.
Race is not an actual biological determinant of how my health will be, but in terms of how that race is perceived in society and how that's actually functioning in the power dynamics and the power systems in which I have to navigate, that is going to have an impact on my health. The inside work is for us to challenge those power dynamics that we have had as funding institutions. Challenge how do we dismantle that and say we're willing and we're imaginative and we're excited for another world that is possible.
We all have to learn together. We're really going to roll up our sleeves and learn as we make these big investments and try to make a difference.
The data have been very clear that there are disparities and discrepancies, not just in the outcomes that are achieved by population, but how people and individuals and populations are treated, how they're diagnosed, how their chronic and acute issues are managed.
The events of the last month have really highlighted the fact that this can't be an implicit process. We need to be explicit about measuring health disparities and assessing the structural racism that's impacting the lives and the pursuit of health and happiness in our membership and in our fellow Americans.